Uterine fibroids, it's a condition affecting hundreds of thousands of women, especially African-American women.
Our very own Angela Green is one of those women. She joins us now in the studio with her story.
Well, Ken and Katie, many of the viewers and you all noticed my 6-week absence back in February. That's when I decided, after years of suffering from excruciating pain and literally blood, sweat and tears, to have a major surgery to help ease some of the complications associated with my fibroids. And before I get to my exact story, let's learn exactly what fibroids are and why one local woman reached out to share hers.
So I was at work one day and I had some nausea, vomiting, pain, not really knowing what it was. Went downstairs to the emergency department, found out I had an ovarian cyst and fibroids.
That day, Nurse Kiera Lewis says changed her life. After an ultrasound, doctors found at least 7 fibroids in her uterus, and with them came symptoms that lasted for years, especially during her monthly period.
If you think about it, if you take a week for the cycle, then a week before, it's like half of your life you're dealing with this pain, this situation, this drama.
Kiera is not alone. Up to 80% of women will develop fibroids by age 50. The growths develop from the muscle tissue of the uterus.
What fibroids are, they're very painful to the point to where it hurts just to sit down sometimes and tell you guys the news.
When I shared my story on Facebook, dozens of women, including Kiera, reached out. Fibroids run in her family.
It caught my attention, and by it being something that I can relate to, my mother, my sister, several other women, definitely a lot African American women deal with this. In my conversations I've had, a lot of people just don't talk about it.
Awareness. It's an issue that my doctor, Marie Rowe with Greenville Women's Clinic, sees all the time.
The most common presentation for a woman with fibroids, they don't come in saying, I have fibroids, what do I do? They come in telling me that they're tired or that their periods are heavy. And a lot of women, they chalk it up to, that's just the way that my body is.
Dr. Rowe says fibroids can be as small as a pea or as large as a watermelon. The symptoms and complications they cause can depend on the number, size, and location of the fibroids, and while they're called tumors, most are non-cancerous.
We don't know why they develop. It can be a genetic predisposition that runs in families. It just happened de novo. We do know that there's a racial disparity with fibroids, that we see more fibroids in African American women, and they tend to grow more aggressively.
Dr. Rowe explains most women with fibroids don't have any symptoms, but at least 30% of those affected will have severe complications.
When fibroids become a problem for a woman, depending on what physical ailments that she has, that can wear on her just like any chronic fatigue syndrome, chronic pain syndrome like fibromyalgia. It wears on our mood and psyche because we know how we feel, yet we don't want to feel that way. But the sense of control is lost until you seek treatment.
There are several treatment options available. Using birth control pills helps to stop the bleeding, but they don't treat the actual fibroids. Then there are surgical options. In fact, fibroids are the leading cause for hysterectomies in women.
Treatment is dependent on your personality. It's dependent on your life stage, whether you desire fertility in terms of future childbearing or not.
Uterine fibroids are also hormone dependent. Hormones make them grow, which becomes a huge issue for women who want children.
It does make me wonder about, are they growing? How would it affect me when it comes time to have children?
Kiera's symptoms are now being managed with birth control pills, and while having children is not a priority, the 31-year-old says her clock is ticking because she recently got married.
My OBGYN told me when I get ready to have a child to come to them, the surgery may be an option for me. It makes me feel like it's going to be very, very painful. Then there's the higher risk for miscarriage, which is painful on another level. Those are the fears that I have.
Now, that fear is something that's all too real for me and my fiance after we suffered a miscarriage due in part to my fibroids. Coming up tomorrow at 5:30, I'll explain how that actually intensified the growth of my fibroids and take you along on the emotional journey to improve my quality of life. Stay with us. We're back right after the break.